How do you remove an osteoma? Well, there's a couple of ways to remove an osteoma. Osteoma is bone, is a piece of bone that's sticking out, a prominent piece of bone. So the place we commonly remove osteomas is on the forehead. People often have, well, I wouldn't say often, but it's a thing. You get a bony osteoma on the forehead, which is a lump on your forehead, which is actually a lump on the bone of the skull. So you have to remove the bone. So it's a little bit more involved than if it was a fatty lump or a soft tissue lump like a cyst. But the way that we tend to do it is with a thing called an osteotome, which is basically a chisel and a hammer, and you just chisel it off, and it's something that can be done under local anesthetic, although obviously we need a discussion with the patient to make sure they're okay with that, because it can be a bit daunting having someone doing a hammer and chisel on your head while you're awake. Other ways of removing osteomas would be with bone nibblers, which are things like sort of pliers, which they've got like teeth which nibble the bone, take the bone away, or I guess you could shave it down. There's all sorts of ways, but we tend to use an osteotome, which is kind of like a hammer and chisel to do it. But it can be done under local anesthetic. But believe it or not, you can do it when you're awake as long as you're okay with someone hammering your head.